Okay, class, we're back. We're still talking on the nose. All right, we said that you had nasal hairs, vibrissae. The epithelium in the nose is a non-keratinized stratified squamous. Now, your skin is a keratinized, but in a mucous membrane, see, keratin waterproofs, but you want water to be able to come up through the epithelium and get to the top. Why? On a mucous membrane, because, let's go over here, a mucous membrane lines a hollow viscous area that opens to the outside of the body. Hollow viscous area that opens to the outside of the body. Nose, mouth, anus, vagina, things of that nature. When we say a mucous membrane, the cells do not secrete mucus. Cells do not. They secrete mucin, which is a glycoprotein. They secrete that to the surface. When water coming from underneath mixes with it, it forms mucus, and the amount of water determines the viscosity. The more water, the least viscous. The less water, the more viscous. So you need these vibrissae and that mucous membrane to keep these pathogens, these little demos of pathogens, from getting in. So the job of the nose, again, is to warm, filter, and moisten the air. The air coming in needs to be warm to try to get it up to body temperature. What did that was the fact it's touching the side walls, and the blood is in, is in underneath here, in the dermis underneath, and it's doing that. All right. Here's the nasal mucosa. You can kind of see the various things there. Okay, this is a scope looking up into what we call the turbinates. I'm not ready for that yet. Okay, I'm going to come here, and that's looking up there. All right, here's some little things there that's not in your book. Swell bodies. Now, underneath this epithelium here, see, that's where the blood vessels would be. And the swell bodies basically are this. If you notice, even if you don't have a cold or anything, that one nostril will not have quite the same flow as another nostril. Now, basically what happens is that these swell bodies, which is an erectile tissue, swells up in one nostril slightly. And what that does, decrease the airflow into that nostril. Why? Because, see, that air is drying out the fluid, which is going to harden the mucus. So by the human body doing one side and decreasing flow, kind of building your water back up to loosen that mucus, then it'll do the other side. So it kind of alternates. Now, that's not in your book, and that's what we call the swell bodies. Here's another thing that's not in your book. This is called Kieselbach's area. It's near the fibrocartilaginous nasal septum on the inside. You have this vasculature there, and it's quite vascular. And now, people that have nosebleeds, let's talk about that. Their epithelium in the nose is thinner, and their blood vessels are a little more dilated, so it's easier for them to get those nosebleeds. And where they normally will occur is around Kieselbach's area, where these blood vessels. Now, you know what you do is you squeeze down on that nose, and you can put your head back to try to close those off, but not everybody. So the more friable and thinner the membrane is, and the more vascularized those individuals that get those nosebleeds. Okay, let's go a little further here. All right, what I'm showing here now are the concha and the turbinates. All right, remember, these were the things I needed to convert laminar flow into turbulent flow. So these are your turbinates, a superior, middle, and inferior turbinates. These are kind of like bunkers sticking out. Now, I'm going to come back to this picture real quick. See, those are they right there. They kind of sticking out. So what would happen is air would come into the nose in laminar, but have to hit these and whiz around. The air whizzing around then would convert that laminar flow to turbulent, and more would hit the sidewall. So these are those turbinates, okay? Now, quite a few of the turbinates are coming off of the ethmoid bone here, of the ethmoid. See, there's the middle concha right there, okay? Then you got the superior, which is now showing real well there. All right. Now we'll go a step further then. Okay. The human nose still, even with all of that, is too small with the amount of air coming in to warm, filter, and moisten the air sufficiently. So I'm going to say that you have some little rooms up in the skull that you may have learned in ANP1 in the skull that we call the paranasal sinuses. The paranasal sinuses. Now what they are cut out areas in the skull covered by a mucous membrane. Cut out areas in the skull covered by a mucous membrane. And I'm going to say they're extra rooms. Why? Because the human nose is just a little too small. So what happens when air comes into the nose, some of the air percolates into the paranasal sinuses, also called the communicating sinuses, because they all communicate with one another via the hallway of the nose. They all communicate with one another via the hallway of the nose. Now what do you have? You have the frontal sinuses, the ethmoid sinuses, the sphenoid sinuses, and the maxillary. Now, how do you get into these sinuses if you're coming through the nose? Okay, there's a way for that. I'm going to come here and I'm going to say between the concha, a little hole called the meatus. That's a hole. So underneath these concha are little holes that will allow the air to percolate into here. Now I'm going to go to that other picture here. Go to the front picture. See, the meatuses are right in that area there. If we had the soft tissue on there. So between the concha are the meatuses, and what that allows for is for the air to go into these communicating sinuses, and then new air pushes old air out, and then it goes up from there. So the paranasal sinus aid the nose in warm and filter and moisten air. There are extra rooms in the skull, that's my word, that air from the nasal cavity can percolate into by entering through the meatuses, areas between the concha. They, like the nose, align with a mucous membrane. They like the nose aligned with a mucous membrane. Okay? So in other words, what am I saying? I'm saying that that's the job of those paranasal sinuses. Okay? Everybody okay? And you can read that in the text. This, like I say, I'm just giving you what I'm giving you for right now. All right? Let's go a step further. Now, we said that at the upper part of the nose, is where you do the smell. All right, so let's go back and kind of think about our ANP1. If you took the skull and you lifted it up, if you took the skull and you lifted it up, there was a little, if you took you take the top off the skull, you look inside, and there was a shark fin looking thing inside the skull. And that particular thing was called the crista galla. The crista galla. Now, lateral to the crista galla was an area called the cribriform plate. Lateral to the crista galla was an area called the cribriform plate. You can look that up. It had little holes in it. Now, what's the purpose of the cribriform plate? What's the purpose of the cribriform plate? The cribriform plate with those holes, see, that would be this right here, because you have in ANP1, you should have learned cranial nerve 1. Cranial nerve 1 is the olfactory nerve. And what it needs to do is to get some neuron receptors, dendritic ends, up into the top of the nose. Well, how is it going to do it? It has to have holes in the skull to get to the top of the nose. So what happens is, so see, it's easy, so don't be probing your nose with anything too metal, because you could easily crack this and be pushing into the brain. Okay? So coming to the top of the nose are these olfactory receptors. See, here's that mucus right there. And here are these receptors. So when air comes in, like rot of air and hell comes up, it is picked up by these receptors, taken in, and then goes into the brain, into the olfactory center in the brain for interpretation of smell. So the purpose of that cribriform plate was that particular aspect there, which then took us into the brain. So you can kind of look. You could go into your skull pictures. I didn't put one. I'm thinking I should have, where you can see the skull cap off and you're looking into it if you have kind of forgotten what I'm talking about there. All right. All right, now let's assume now that we're leaving the nose and we're going behind the nose now into the nasopharynx. So we're going into the nasopharynx. Remember now, the pharynx was made up of three parts: a nasopharynx behind the nose, an oropharynx, and a laryngopharynx. So where we're going now is into the nasopharynx. Okay, that's where we are now. All right. Now, the nasopharynx really is going to be a pseudostratified ciliated columnar epithelium. And you can look back at my deal here to get an idea of all that stuff there. Okay. All right. All right. So what we're looking at there, because see, goblet cells, brush border, epithelium, respiratory, but the respiratory will be a pseudostratified ciliated. All right. Where are we now? All right. I'm coming into the nasopharynx. Excuse me. I'm coming into the nasopharynx, and I'm going to say, come here to this one, I'm going to say that there are 4 holes into the nasopharynx. I'm going to say there are 4 holes into the nasopharynx. 2 from the internal nares, known as the choana, or interesting to say it in simple everyday terms, the nostrils, and 2 on the side. Now these 2 would be in the front, and 2 on the side that I'm going to say come from the middle ear, known as the auditory tubes. 2 auditory tubes are also called the eustachian tubes. All right, let's explain that. Okay, in the ear, you have an outer ear. You have 3 parts of the ear. You have an outer ear from the tympanic membrane out. Then you have a middle ear where you have these 3 little bones called the malleus, incus, and stapes. Then what that's going to do is push on something called an oval window, and in here is the inner ear. This is where the cochlea is. Okay, the vestibule and the cochlea. The cochlea is for hearing. The vestibule is for balance. So you have an outer ear, a middle ear, and an inner ear. Now I'm interested in this middle ear. The middle ear is closed in. See what has to happen? Vibration has to hit this eardrum, vibrate these 3 bones, which then vibrates this oval window, and then the cochlea does the work to get the interpretation of sound. And then here's the cranial nerve here, which is called the vestibulocochlear nerve. The vestibular, that's cranial nerve 8, takes it into the brain for interpretation of balance and hearing. All right, but this is closed in. So air could get trapped up into the middle ear and you couldn't compress it. So what you have to constantly do is decompress on a constant basis this middle ear. That's where this tube comes, known as the eustachian tube or the auditory tube. So this here calls pharyngotympanic tube. So, okay. Eustachian is an older name for it that everybody kind of uses. Now, where does that tube go? That tube is going to go right here into the opening. So it's going to go into an opening right there, which would be the opening into the middle ear. The opening into the middle ear. Opening of right there. See, it's showing right here, which I kind of will move this arrow a little bit there. I can get it there. We'll pull it up a little bit. See, right there, I kind of had the arrow down there. Okay, right there, that's that opening. Now that's going into here. So what happens is that you could get this clogged and you'd have a headache. That's why swallowing. See, a person swallows when that middle ear gets clogged, you would force to pull that out. Now kids, to say why they have middle ear infections, the tube is narrow and it's more horizontal. As the head grows, the tube gets bigger and more vertical, so it drains easier. That's why kids have more middle ear infections than adults do. But that's called that, and what that allows you to do. But you also can see if you get a throat infection, you could also get an otitis media. That's what the technical term for it, because that bacteria would walk straight up into the middle ear there. Otitis, call it otitis media. Otitis externa for outer ear, otitis media, otitis interna. All right, we're going to close here and pick it up